Hello, and welcome to my guest lecture based on the tentative topic of HIV infections and AIDS. First off, we'd like to start by defining and learning what exactly HIV and AIDS are. HIV is the human immune deficiency virus, which is the virus commonly known to cause AIDS. HIV destroys the body's natural system of immunity to diseases. Once this occurs, the onset of opportunistic diseases can take over, which can lead to death. What is AIDS? It's the acquired immune deficiency syndrome. Most common name for this infection, which is linked to HIV, is resorted to as AIDS, more of like an umbrella term, kind of. Most commonly spread through the interactions of sexual intercourse, through anal intercourse in some cases. It, like HIV, it's the same thing, compromises immune health and overall regularity. How does transmission occur? Transmission of HIV or AIDS can be transmitted through various ways, which can include sexual intercourse with someone who's already infected, transmitted through blood, semen, secretion of the cervix or vagina. The possibility of transmission can be done through hypodermic needles that are included when, for example, most drug users use them to inject a certain type of drug into their bloodstream, which then can affect the needle. And once it gets transferred from user to user, known as sharing, this spread of transmission can occur if one of those users is infected. In the scenario of pregnancy, the mother who has the HIV infection can transfer that to the offspring during the duration of the pregnancy and throughout childbirth. Another example is an accidental prick or poke of a needle, say in a medical setting or situation where a person is being detained and patted down for safety and security measures of officer or clinician staff as they enter the judicial system for processing. Accidental pricks are known to happen, which could also transfer the infection from one to the other. Continuing on, we have testing and screening options. There's multiple ways that you can test and screen for HIV. It can be conducted in many different forms. Blood testing is the most accurate at detecting infection within 30 days. Saliva testing is not as accurate, but still utilized as a test to see if there's any type of relatable infection. There's also home testing, which are just not as accurate as any type of laboratory or blood screening. Finally, we have the most effective way to screen for HIV or AIDS is through the use of NAT, which is an immunosyne and nucleic acid testing, which also utilizes blood samples to detect an infection and blood cell counts. Next, we have some treatment options. There's currently no clinical approach that completely resolves the symptoms and therefore is considered a cure. There's some methods using a prescription of ATZ mixed with a bunch of different medications can help slow the progression of the infection throughout the body. In addition to that, it cannot reverse the effects of the damages as far as what has happened throughout the course of the infection spreading through the body. In addition, there is DDI, which is a diazepam, which is known as an antiviral medicine that helps to reduce the spread of the infection, but is not a cure. Some prevention techniques can be testing before participation in sexual activities. The use of contraceptives such as condoms reduce the likelihood of a transmission from an infected person to a non-infected, and properly sterilizing of medical equipment and the use of blood screenings for blood transfusions. One other piece of advice is do not participate in activities that include sharing of a hypodermic needle to ultimately prevent bloodborne pathogens. As you can see, I have some pictures here to help you describe what prevention techniques could look like for most of us. And in conclusion to this topic and slide, this has been my presentation over interests on HIV and AIDS, followed up here by these references. Thank you for tuning in, and I hope this answered some of your questions.